What's up, everybody? It's Dr. J here, and welcome to the Kaizo Health channel. This is the channel where we're able to provide holistic, evidence-based information to help you live a healthier and happier life. Today, we're going to be talking about delayed pain and injuries from car accidents and what you can do about it. Okay, let's start here. If you've been experiencing pain or other symptoms days, weeks, and even months from a car accident, you're not alone. Car accidents can be scary, shocking, and oftentimes traumatizing. Even the effects on your body may not show immediately. So when you're involved in a car accident, many times there is acceleration forces that are imparted onto the spine and the rest of your body. If you're stopped at a stoplight, for instance, and you're hit from behind, your neck will accelerate, your head and neck will accelerate rapidly backwards and then forwards and then backwards again. It's these acceleration forces that causes trauma to the tissues of your spine, creates inflammation and pain, and if not addressed right away, long-term pain and disability. Many times you're in shock. You've got adrenaline flowing through your bloodstream, and your body is initiating this fight or flight response. So many times patients don't even know or realize they've actually incurred an injury. What's really interesting is that you may not be experiencing any pain at all days, weeks, or even months after the traumatic accident. This is very common that sometimes patients just don't experience pain right away. After the shock goes away, the common symptoms that patients experience are headache, nausea, neck, back, shoulder, knee pain, or other areas of the extremities, as well as swelling and numbness and/or tingling. If you notice within a day or two that the symptoms that you're experiencing after a car accident have not gone away, it's probably an indication that you've got a more serious injury that requires evaluation from a healthcare provider. Here's why it's critically important to seek out care whether your symptoms are mild, moderate, or severe. What we know from the scientific evidence is that when patients present beyond 8 days from symptom onset, treatment time can take 1.5 times to 2 times longer. What we also know from the most recent clinical practice guidelines, which is the highest level of scientific evidence, that non-pharmacologic interventions first before drugs are the recommended sources of treatment. So you might be wondering, okay, so what do I do next? For any patient who's experiencing these types of symptoms after a car accident, I highly recommend that you seek out an evidence-based chiropractor first. Someone who can provide a multimodal approach to not only your symptoms, but to ensure that your function is restored so that your symptoms don't continue or come back. There are 3 ways in which doctors of chiropractic can help. Number 1, chiropractors treat the whole body. Lots of patients think that chiropractors just treat necks and backs, but in fact, we treat the entire body. Shoulders, knees, ankles, elbows, wrists, muscles, joints, tendons. Chiropractors treat all of those areas with a multimodal approach. 2, it's non-invasive. No surgery, no drugs. It's a holistic approach to ensuring we're not only decreasing your symptoms, but we're restoring your function. 3, it's an evidence-based approach. It's supported by the scientific literature, and years and years and years and millions of patients have demonstrated that patients who seek out appropriate evidence-based chiropractic care after a car accident get great short and long-term outcomes. So in summary, 3 recommendations that I can make for you if you or a loved one has been involved in a car accident. First and foremost, early intervention. The sooner you take care of your symptoms, the faster you're going to get well. 2, make sure that you seek out and find an evidence-based conservative healthcare provider, especially an evidence-based chiropractor who can treat the entire body to ensure symptom reduction and elimination, as well as improved function. 3, get advice on activities of daily living while you're not in the office to ensure that you're not doing things to your body while you're in treatment that prolong your course of care. Remember, Doctors of Chiropractic and the treatment that we provide is incredibly safe. So seek out the appropriate healthcare provider, say no to drugs, and get the best short-term and long-term positive outcome. Thanks everybody for watching. I really appreciate your time. If this video was helpful, please make sure that you hit the like button and that you also share with loved ones, and that you make sure that you follow the Kaizo Health channel for a lot more evidence-based content to come. We're here to serve you and ensure that everyone watching and everyone on the planet lives a healthier, happier life. See you next time.